Sickle cell anemia is a major health concern in Africa, affecting millions. This inherited blood disorder causes C-shaped red blood cells, leading to severe pain, organ damage, and other serious complications. Hello everyone, this is Dushyant Maggu from MedNews India. Today we are joined by Trevor, 9-year-old boy from Kenya who came to India for a life-saving bone marrow transplant with his father, Mr. Kennedy. Their journey offers hope, showing that with the right care, a brighter future is possible. Now let's hear directly from Mr. Kennedy and Trevor as they share their story. So Mr. Kennedy, can you share a little about Trevor's journey with sickle cell disease before the bone marrow transplant?
Yeah, Trevor was diagnosed at 4 to 6 months. Yeah, he was developing a persistent cough, fevers, and then now at that point we were trying to manage the fevers with the painkillers, giving cough syrups. But because it persisted, I said, let me take him to the hospital. And at that point is where they realized his HB was very low. And they recommended an electrophoresis, which came out to be positive for sickle cell disease. Of course, it was not very easy to accept, so we even thought of trying other labs if we could get other results, because I'd seen my cousins with sickle cell disease, how the outcomes were. They were not living a full life, a compromised life. So having Trevor with the sickle cell disease was not an easier result for us to accept from the hospital. So we even tried other hospitals just to confirm, but still it came out to be positive. So from that point when he was diagnosed, of course, blood transfusion he was given at diagnosis, at the point at which we had taken him to the hospital, and he was admitted for some days. So that is the kind of life he had to start living from then on. Admissions with transfusions frequently. I think for that 1 year I was admitted twice, transfused, and then he now started being admitted consistently once in a year around the month of March, and transfusion had to be done at those points. So it is a fragile life to live when you are diagnosed with sickle cell, or even if you have it and without knowing. It is a very fragile life. You don't go to school consistently because most of the time the fevers come, the coughs come, infections are frequent, so you don't have the luxury of going to the school as consistently as other children. So it was a very heavy something on us as parents. And I think for kids who really don't know the real outcome of a sickle cell disease, they don't understand. All that burden is carried by the parents who knows what are the possible scenarios with their kids who have sickle cell disease. So normal childhood plays they can't do because they get tired easily. Their blood levels are low, so infections are frequent. So it was a bad thing. I think it is something that you'd never wish for a child to have a sickle cell disease. Yeah, and especially for him, his HB settled at a very low level. It was a 6.5. So immediately he gets a crisis that lands him to a transfusion, because it will go very easily to below 4 and like that. So it was not a very easy time with him.
What led you to consider a bone marrow transplant as a treatment option for Trevor?
Having had other crises before, and now in 2022 September we lost the mother, so I became the sole parent of him plus other three children. Of course, one of them is also a sickler, but the HB is higher, so he may not be having very frequent crises. Being the only parent, I remember one day I had traveled out of town to go to work, and I went, but in the evening I'm calling home to see how they are doing. I'm told he didn't wake up well in the morning and therefore didn't go to school, and I instructed that he be given the usual medications that we do keep to give them to just manage, and we thought it would come, it would clear the symptoms and the crisis. Unfortunately, the following day he wasn't, so he was rushed to the hospital. I had to cut short the trip, come back, and the state in which I found him, he was so bad, he was so severe that I didn't imagine him coming out of that situation. But fortunately, after we stayed in the hospital for 13 days that time, it took so long to manage the situation, 13 days in the hospital. So after that is when I said, for how long will I remain living with this thought of crisis coming on and off, and maybe unfortunately one of the crises may come and may not give him the light of day. So I said, let me try to see. I googled, no one recommended bone marrow transplant to me, so I started googling. I googled, tried to see what are the possible options of dealing with sickle cell disease, and bone marrow came in. Of course, you Google and you even go to see what are the outcomes, and then what are the costs, where can we do it. At such points, there are very few options available for where to do it. So after that crisis, I said I must do something. So I approached the doctor who used to see him, and told the doctor that for me, I'm thinking I need to pursue a bone marrow transplant option. So she said it is okay, filled for me the medical form, which we took to the medical body in our country, took to the ministry, and that was in that same time, that was 2023, when you had the crisis. So in 2 months after, I got everything that was needed to do a bone marrow transplant. And of course, when I was ready with every paper, then I realized I didn't have enough money to meet the cost. So I postponed the journey for 1 year. Of course, that landed us to 2024 November, when we came to India for the procedure.
What was the experience like during the transplant process itself?
Deciding for bone marrow transplant and eventually going through it are worlds apart, because when you Google a procedure, you want to see what are their possible outcomes, what are the situations it lands you at. So when we eventually landed here, and of course you also get to know people who have gone through and people who are still going through, you inquire with them. I didn't have, when I was starting the process, I did the matching, and I only did for the sister, the elder sister, and it turned out to be half match. So I said, if the sister is half match, the parent is also can also be half match. That is the best case scenario for parents. So I said, instead of carrying the sister, let me come myself to be the donor, because I knew I would be a half match as the sister. So we came, we talk stories. So I was coming for a half match transplant, and telling stories with the others. Half match bone marrow transplant takes longer because of the pre-treatments before the real procedure. So I was ready to go through that. But now when you come around, you get stories around the outcomes for half match. It is much lower. Fear started creeping in. So more anxiety, how will it be? I remember at one point, I felt like, should I really go through this procedure? But then when I first made the visit to the doctors, they asked me if I do have any other child apart from Trevor and the sickling other brother and my daughter. So I told them there is the last born brother, whom at the point of doing the matching was too small and I didn't consider him. So they said, we suggest that you have that boy tested. So we had to send for the kits. The sample was taken and was brought within 4 days after the request was made. So the sample came. It was tested. After 1 week, we had the result, and it was a full match outcome. So that at least gave me more confidence to go through the process. But again, when a bone marrow is a bone marrow, when all your native cells have been killed so that you get the donor cells, if all your native cells have been killed to get donor cells, you are exposed to lack of immunity and anything can happen. So that point is a point of a very anxious moment. You don't know how will he come from that point back to a normal immunity. But so that anxiety every day. And I remember when we were now it was done, of course he developed some complication of seizures that really also shook us, but he came out of it. So at day 12 post-transplant, he was discharged, and then we started now review. So the anxiety continued, because now after every review you want to see how are the cells coming up. Fear of rejection is there, fear of his cells still coming up to produce the sickled cells is there. So every moment when we were doing lab tests, we were very anxious to just want to see the results. Are they coming out nicely? Are the donor cells starting to produce cells nicely? Are we moving towards the normal cell levels? Which for sure is not an easy time until we start seeing progressively the cells coming up and getting to the normal level.
How is Trevor doing now, 65 days after the transplant? How has his life changed post-transplant so far?
I think yesterday, that was when we did our review, because now as it progresses, the number of reviews reduces. So yesterday we did the 64-day review, and we were very glad that all the cells were above the normal level. They were met the normal level. Of course, the red cells were the last to cross by yesterday. All the others had crossed to the normal level earlier. So the boy is really clinically doing very well. The doctors are really very happy with what they are seeing. Every other time we go for reviews, they are very happy. It is clinically very well. All the parameters. Is a guy who had never seen an HB of above 7, but by the last review it was 12.5, which is normal and is the highest from the bone marrow transplant days. Platelets are okay, white blood cells, red cells for the first time crossed to the normal range, and when you look at him, is very okay. Is very okay, and we are very happy for the results we've received and we are seeing, and are very thankful to the doctors, of course, first of all to God, who revealed to us this process and even gave us the courage to pursue it. It is not an easy decision to make.
Okay, so what would you say to the families considering bone marrow transplant? Like maybe any message to the people back home in India?
Yeah. I may not just say it to those, I may not just talk to those who are considering transplant. I'm really convinced that our sickle cell disease patients have a right to a better quality of life after bone marrow transplant. So I know there are many out there who may not be aware of the options available. I would really recommend that bone marrow transplant is a very viable option that is available for our patients with sickle cell disease. And being aware is not good enough, but acting with the awareness that we have is everything. We need to be bold to decide for our patients to go through bone marrow transplant. Of course, the doctors would advise if a patient is ripe for a bone marrow transplant. So once we get aware, let's approach our doctors, the experts within the bone marrow space. They will advise accordingly and will take us through the journey of having the bone marrow transplant. So I would at this moment also say that it is not the cost of transplant that should determine whether we choose for it or not. The quality or even the life is more than anything that we can give as a gift to our patients. Let's first decide. When we decide, help will come. We did not come because we had all the money that was needed, but friends came in through for us. The hospital were waiving some bills for us. So let's decide and pursue bone marrow transplant at the earliest possible opportunity that we get to know it is available, because again, complications come because of our late interventions. If we intervene early, I've seen many who have come out of it successfully, and many are really now benefiting. They are going to live their normal lives after the bone marrow transplant.
Thank you for being with us and sharing your journey. Sickle cell anemia does not have to be a lifelong burden, as treatments like bone marrow transplant can cure it completely. That's it for today. Stay tuned to MedNews India for more updates and interviews. See you next time.